I'm Dr. Youself, consultant in internal medicine at Continental Hospitals. Today I will be discussing about a common disorder that's not so commonly diagnosed. Chronic fatigue syndrome is a clinical disorder characterized by persistent and unexplained fatigue causing severe impairment in day-to-day functioning. Besides intense fatigue, patients also report concomitant symptoms such as pain, unrefreshed sleep, and cognitive dysfunction. There are a certain diagnostic criteria formulated by the US Disease Control. Fatigue that lasts for more than 6 months, fatigue that is not related to any organic disease or continuous exertion, fatigue that is severe enough to cause substantial reduction in occupational, educational, social, and other physical activities. If anybody experiences more than 4 of these symptoms, such as headache, sore throat, tender lymph nodes, muscle aches and pains, joint pains, abdominal cramps, unrefreshed sleep. Exclusion criteria includes any medical conditions causing the fatigue, any major depressive disorders, delusional disorders, schizophrenia, dementia, any alcohol or substance abuse, anorexia, severe obesity with a BMI of more than 40. This is in 75% of the patients. It is the women who are experiencing these symptoms, particularly in the age bracket of 29 to 35. Well, we see in other age groups as well. There is no specific cause to this. However, there are a few theories postulated which could suggest the predisposing factors. The predisposing factors could be any childhood trauma, be it sexual, physical, emotional abuse, emotional or physical neglect, any childhood physical inactivity, pre-morbid psychiatric illness. Any precipitating factors include surgeries, pregnancy, infections. Usually, flu-like illness is a very commonly reported condition following which patients experience chronic fatigue. There is no specific test to diagnose chronic fatigue syndrome. However, a meticulous history taking, detailed systematic physical examination are warranted to identify the other causes of chronic fatigue syndrome. For example, any endocrinological abnormalities, rule out neoplasms, any heart failure, etc., to rule out a few. There is no specific treatment per se, but the most disrupting and disabling symptoms need to be addressed first and taken care of. Cognitive behavioral therapy and graded exercise therapy have been found to be beneficial. A good sleep hygiene is advocated. Sleep on fixed time, wake up at a fixed time, some form of physical activity, and maintain a healthy, well-balanced, nutritious diet. Thank you very much.